Takes us to the next ingredient here, because in this battle against the virus, the ammunition that matters most right now is medical staff, along with critical supplies they need.
Right, and tonight we are getting a much better picture of what Michigan has and also the efforts to try to get more. Dr. Frank McGeorge is here now with an update for us. Doc?
Yeah, well, an emergency order issued by the Michigan Department of Health and Human Services actually requires that hospitals provide daily updates to the state on their bed capacity, their levels of PPE, testing capacity, number of ventilators, and other key numbers. Tonight, we are able to share one of those reports and a snapshot of what we have where. As of yesterday, the state had 27,762 licensed hospital beds, 25,375 beds that were in place before the state of emergency, plus 2,387 that have been added so far. Now, as of March 26th, hospitals reported they had 1,622 ventilators. We don't know how many of those are currently in use, but the state's chief medical executive made it clear that number is not enough to meet the anticipated need.
We know we're on the upslope right now of cases. We know our hospitals are going to need more beds. We're going to need thousands more ventilators, and a lot of people are going to get sick.
The levels of other supplies are broken down by region. For example, as of yesterday, there were more than 300,000 N95 masks, nearly half of those in Region 2 South, which encompasses Wayne, Washtenaw, and Monroe counties. Region 2 North had just 26,000 N95s. That region includes Oakland, Macomb, and St. Clair counties. The goal of these daily reports is to help the state make sure scarce resources are being shared between regions as needed, even as they desperately try to get more.
To date, the state has already expended more than $80 million to begin securing the more than 20 million masks, 2,000 ventilators, 9 million ounces of hand sanitizer, more than 255,000 boxes of gloves, 2.4 million gowns, more than 2,000 beds.
Now, those are items that the state has ordered. As we've seen, that is no guarantee that they'll be delivered. It's also important to note, although all of the hospitals are required to supply their inventory numbers to the state, yesterday's report had only 74% of hospitals reporting. Back to you.
Yeah, and Doc, how much do these numbers really mean? Because obviously, as we've been watching them, they're changing constantly.
Yeah, that's so true. Given the situation that we're in, the numbers are already out of date by the time they're reported to the state, but they at least give us a little snapshot in time and the ability to see where we still have some capacity and supplies, and of course, where we don't.
All right. Thank you, Doc.